Hello everyone, and welcome to the first of a couple of videos on pregnancy and childbearing. In these videos we are going to go through and look at, first of all the different changes that are occurring to the woman or to the mother, the hormonal changes and the physiological changes that are going to occur. We'll touch on some of the pathologies that can occur during pregnancy, and then we'll finish up by focusing on the effects of exercise and how to develop safe exercise recommendations for women who are pregnant. So I hope this is a area that you enjoy hearing about and one that perhaps you can relate to, whether or not you or someone you know has been pregnant. So we'll start with the hormonal changes. And really the hormonal changes start at conception. When the egg is fertilized, it starts to produce a chemical called human chorionic gonadotropin. And the purpose of this hormone is to signal the ovary, and then the ovary in turn is going to release relaxin, estrogen, and progesterone. And so I'll go through what each of those do. But if we look at human chorionic gonadotropin, or HCG, this is the chemical that is detected in early pregnancy tests. And you can see very, very shortly after conception, the amount of this hormone skyrockets. And so this is what is being detected in those EPT, in the urine, in the EPT, early pregnancy tests. And you can see here they have the progesterones and estrogen on this graph, and you can see that once the HCG peaks, that slowly we see estrogens and progesterones increasing. And so there's an area in the ovary called the corpus luteum, and that's what's releasing these. And we've talked about relaxin a lot of times before. This is the chemical or the hormone that helps to relax ligaments and makes connective tissue more pliable. And the main reason is to relax those really strong ligaments that are around the SI joint and then around the pubic symphysis, so that the pelvis can relax and the pelvic outlet can become enlarged to allow for passage of the baby during the birth. However, we know that the effects aren't isolated to the ligaments around the pelvis, and so all the connective tissue is more lax in the body, and we can see this effect in particular in the weight-bearing structures, and this can predispose women to musculoskeletal problems and pain, and particularly pain in the low back and the SI joint. Estrogen, of course, is a very important hormone during pregnancy, and this is going to stimulate growth and development of the uterus so that it can provide a area for the embryo and fetus to develop. It's going to stimulate contractility of the uterus, which is going to be important during birth, of course. It's going to suppress ovulation, because if the woman's already pregnant, she doesn't need to ovulate anymore. And then finally, it's going to stimulate growth of the ducts in the breasts, so that again after childbirth the woman's able to breastfeed. Progesterone also contributes to development of the uterus, and paradoxically prevents uterine contractility, so we don't want contractility until, of course, the time of birth. Progesterone is also important for breastfeeding because it stimulates development of the tissues that actually produce breast milk, whereas the estrogen is providing growth for the delivery system, the ducts. And then we also see that relaxin can relax smooth muscles throughout the body, and so we see that this can lead to some consequences or complications in pregnancy. So women are more prone to urinary tract infections, so when the smooth muscle around the urethra and ureters is more relaxed, it can result in stasis or backflow of urine. In the GI system, if there's slowed motility or movement of food through the GI system, this can result in indigestion if the food's not moving out of the stomach as quickly, and it can result in constipation if the food isn't moving through the intestine as thoroughly or quickly. And then finally, an issue that's pretty common to women who are pregnant is a little bit of swelling in their legs, and this is because of dilation of the veins due to venous stasis. So again, the smooth muscle around the veins is a little bit more relaxed, the veins are a little bit more distended, and this can result in leakage of fluid into the interstitial tissue and some edema in the feet and legs. So if we continue with our hormonal changes, we see that after the first couple of months, as the placenta is developed, the placenta is now taking over to the regulation and the release of these hormones, particularly estrogen and progesterone, and in addition it produces another hormone called human placental lactogen. And this has an impact primarily on metabolism. And what we can see is that the woman has to be more attentive to nutritional intake and the balance between activity and intake so that she doesn't become hypoglycemic, because this human placental lactogen is going to shunt fuel, in particular glucose or carbohydrates, to the fetus so that the fetus has their energy needs met. So this, of course, is going to have impact on exercise. If a woman's exercising, we want to make sure she's got adequate nutritional supplement. And then two other glands that are very important in hormonal regulation is the thyroid gland and the pituitary gland. So the thyroid gland is very important for metabolic rate, and we do see that metabolic rate in the woman does increase up to about 25%, and again, this is to meet the developmental needs of the fetus. And then finally, we see the pituitary gland enlarging, and this is very important to release hormones related to growth and development. So those are some of the hormonal changes that we see, and again, I'm sure many of you have been either pregnant yourself or around women who've been pregnant, and you can probably recognize the impact of some of these changes. We definitely see changes to their neurological system. Women, it's very typical for women to become a little bit emotionally labile. In other words, they cry easily, they laugh easily, so their emotions are kind of a little closer to the surface. We can also see anxiety being produced. People are a little bit more, women are maybe a little bit more touchy. This anxiety, of course, is partly related to the fact that there's a new baby on the way and all the incumbent responsibilities that entails, but also the hormonal changes can make that anxiety triggered a little bit more easily. A lot of women complain of difficulty sleeping. Now later in the pregnancy, this could be just because of sheer physical discomfort, but we can also see earlier in the pregnancy that this is related again more to hormonal and chemical changes in the body. We do see some perceptual changes that can occur. We see this with vision. The corneas become more sensitive, and I definitely saw this when I was pregnant. I had never really needed or worn sunglasses much before this, but I definitely needed to wear sunglasses on bright sunny days. Especially I was pregnant through part of the winter, and so when it was sunny and there was a lot of snow on the ground, I really just, it was very painful. I just couldn't tolerate not having sunglasses on. Another thing we see is alteration in the proprioception, and we talked about the fact that relaxin relaxes the ligaments, and so of course this is going to throw off the proprioceptive role of the ligaments, so the information they're sending isn't going to be quite the same. And so we do see balance and coordination changes in women who are pregnant at times, and this again can have an impact on the types and the safety of exercise. So in general, we definitely see emotional, cognitive, and perceptual changes that can occur with pregnancy. Another system we often think about is the gastrointestinal system, and we've already mentioned the fact that metabolic rate is increasing and that there are changes in metabolism, and so this definitely can increase a woman's appetite. Definitely eating for two, though really your metabolism is only increasing by 25%, so you're really only eating for 1 1/4, you and the baby. But we definitely see increased appetite and thirst. Thresholds of sensitivity are different, and so might see that things taste a little bit better if they're spicier or saltier or have a little bit more of a bite to them. Many women experience cravings, and those just aren't imaginary. They are true physiological cravings for different types of food. People may also become ill or have upset stomachs or due to some specific foods, and again, those are what we would call aversions to certain foods, and they are also real, not just imagined. So I definitely remember really liking spicy foods when I was pregnant, really craved those a lot. And the only other, I never had any trouble with morning sickness. About 60% of women do experience that, which is a pretty high number. We're still not really sure why some women get morning sickness and other women don't. They think it's due to the human chorionic gonadotropin, but again, that's hard to say because that goes up in everyone, and obviously, again, only about 60% of women actually get morning sickness. But I was lucky enough not to have that. But definitely one thing I could not stand was the smell of any kind of cooked egg. So whether it was fried or scrambled or whatever, I couldn't be in the same house that was cooking eggs, or I would be ill. So it's just really interesting. I'm sorry that we can't be in class together to have you all share what your experiences were, but there is quite a variability, but there is a definite impact on the gastrointestinal system with pregnancy. And then we've mentioned before that with the relaxation of the smooth muscles, that the speed or the motility of the GI system slows down. And again, that can contribute to heartburn, some reflux, some constipation. So in the urinary system, I know this is not a picture of the urinary system, but it shows you the change in the size of the uterus. Since blood volume's going up, as we'll see in a minute, our blood volume increases 35 to 50%, and so there's just more blood for the kidneys to have to filter. Kidneys are going to increase in size to accommodate for that, and we certainly see the impact of, as the uterine size increases, that is sitting right on top of the bladder, and so we definitely see increased frequency of urination. But I definitely noticed this occurring very early in pregnancy. Didn't have to wait until the uterine size got bigger. There's definitely increased frequency of urination because of the increased filtration rate and the increased blood volume. We also see an impact on respiration, and again, as you see, especially in that 7 to 9 months, you see the size of the uterus pushing up against the diaphragm. So it makes it hard for the person to take a deep breath because, of course, the diaphragm has to contract and go downward. But even before that, we see increase in oxygen consumption, so by about 15 to 20%, again, to meet the needs of the fetus. And then the other thing is we see a lot more tissue congestion in the upper respiratory tract, more secretions in the respiratory area, and so again, that's just part of the relaxation of that smooth muscle, allowing more fluids into the interstitial tissue. With our cardiovascular system, as I mentioned, blood volume is going up. Red blood cell mass is always still going up, which is a good thing because we need red blood cells to carry oxygen. But the relative change is not 1-to-1, so we are seeing a 35 to 50% increase in blood volume, but only 18 to 30% increase in red blood cell mass. And so this leaves us with what's considered physiological anemia. So the amount of red blood cells hasn't increased in the same proportion, and so sometimes people will feel tired or a little bit short of breath with activity because they don't have the same volume increase in red blood cells. We definitely see an increase in cardiac output. As I mentioned, the blood volume's increasing, and so cardiac output, of course, is stroke volume times heart rate. Both stroke volume and heart rate are increasing. You don't have to memorize these percentages, but I think it's striking to see the degree and the change. And so when we're thinking particularly in relationship to increased activity, especially if we have a person who's maybe not in great shape to start with, their cardiac output's already increasing, by half again as much as what it was before pregnancy. And so if we try to increase their activity then, and they're not in a very well-trained state, they may not tolerate that exercise very well. Because of the venous relaxation, of course, the dilation, that's going to drop our blood pressure a little bit. So we have a little bit increased cardiac output, and again, if the blood pressure drops and the heart rate has to increase to meet that, that's going to increase cardiac output even a little bit more. So there's a lot of impact already on the cardiovascular system just through pregnancy and not with any increased activity. The one thing that we have to be careful of, again, if we're looking at the increase in the size of the uterus as the fetus grows, is that if the woman was to lie flat on her back, that's going to impact and compress the inferior vena cava, which is further going to slow venous return, and it could even impact on the abdominal aorta. So we just want to make sure that when we're positioning the person for prolonged periods, whether it's for sleeping or for exercise, we don't really want them in supine for a very long period of time. Left side lying is considered the optimal position because the vena cava, of course, is more on the right side of the trunk. So that's going to be the place where it, on the left side, is going to be the place that it actually impacts the least. Remember, when the woman is lying and side lying, you'd always want to recommend a pillow between the legs to diminish stress on that SI joint. And remember, the ligaments are kind of loose, and so the pregnant woman is more prone to SI joint dysfunction. So having them lie on their left side, the pillow between their legs would be highly recommended for sleeping. I talked about the musculoskeletal system a little bit, the ligament laxity that we talked about, the fact that the pelvic floor muscles, we'll show a picture of those in a little bit. The pelvic floor muscles are really what kind of support, if you think about the pelvis as like a bowl, the pelvic floor muscles are really the bottom of the bowl. And so they're supporting everything in the pelvis, including the weight of the increasing weight of the fetus in the uterus. So there's a lot of stress on those muscles. They can get stretched during pregnancy, and they can be stretched or even torn during delivery. And then finally, of course, the abdominal muscles are getting stretched out. So we know that when muscles are elongated past their resting length, they aren't as strong as they could be because of the actin and myosin aren't overlapping quite as much. So we'll want to work with the woman on core strengthening to keep those abdominal muscles engaged and to help promote proper posture, because that's kind of our next thing, is with the stretching of the abdominal muscles if they're weak, and the increased weight anteriorly. That increased weight will be pulling down in front of the pelvis and will promote anterior pelvic tilt and a lumbar lordosis. So we want to encourage, kind of that up and in maneuver with a more neutral pelvis and create some stability so that we don't see all these compensatory postural changes. So if we have that increased lumbar lordosis, then we tend to see a compensatory kyphosis and a forward head, and often hyperextension of the knees. And we definitely don't want to promote these postural abnormalities for several months. So we want to try to normalize posture throughout pregnancy. So that's what we have right now, and this ends this first segment of the video, which just focused on the changes that the woman is experiencing. In the next video, we'll look over some common pathologies and then talk about how to develop a safe exercise program. All right, thank you very much.